I've talked to farmers, I talked to people in the restaurant industry. Now we're talking to you, public health, right? It's a big thing, obviously. Can you talk to me what exactly public health is and what that involves?
Sure. So public health is essentially preventing disease and enabling people to have a high quality of life. Public health, it says, is work that's not sexy. We're normally behind the scenes. You don't really see us a whole lot because public health is more about prevention. Mm-hmm. So you normally don't see public health unless there's a failure. So if you see an outbreak, like say at a restaurant or some other
salmonella or
environmental thing,
food issues or lead water, Flint,
then
Michigan.
You see public health, and you're like, oh, that's the health officer. Mm-hmm. I didn't even know we had one. But public health, like I said, maternal and child health, violence prevention, fatherhood initiatives, environmental health, so food inspection, lead prevention, public health emergency preparedness. Then you get into the data, the science, the lab, the epidemiology, infectious disease, so there's surveillance if there's disease outbreaks, little outbreaks that pop up that need to be addressed right away. And then you get into all of the clinical practice aspects.
Milwaukee was the first city to declare racism a public health crisis. What exactly do you mean racism is a public health crisis? Because you did it, then Boston did it, then all these other cities, you led the way.
Milwaukee should embrace the fact that we were the first to do this because it helped us with our COVID response. Many others weren't even thinking about that. They were thinking of it as an isolated thing, but it helps change your perspective on how you address all health-related issues. What this means when you say racism is a public health crisis, it means that it's a call to action. We know that Milwaukee has long had issues with segregation and racism. People that have grown up here can tell you, especially if they have elders or folks that had migrated here and seen the change through the 1960s to the 1980s to where we're at today. And you still see many of the effects of redlining and segregation playing out in a variety of health disparities in our city. So if you look at infant mortality, you look at childhood lead poisoning, you look at obesity, you look at violence, you look at COVID, you see the very similar, these heat map distributions where you see various parts of town that have the highest incidence or prevalence of disease. Traditionally in public health, we have epidemiology, which is studying statistics or data to prevent disease in a nutshell. And we were looking at this data and we felt it was important to share the race and ethnicity data for COVID early on because we had this increased awareness because we had made this declaration in summer of 2019. One of the negative things about us revealing the race and ethnicity data for COVID, we saw similar trends. We saw these disparities by race and ethnicity, whether it be indigenous populations, Black populations, Latinx populations. We started seeing this all across the country. This is a problem. We need to adjust the strategy for intervention because they have general messaging, like stay home, save lives. We still see a lot of Black and brown people that have essential jobs that are, grocery workers or,
you talk
drivers.
About the racial wealth gap because of the low paying jobs.
Right.
The high paying jobs, I'm privileged enough to work at home, right? Mm-hmm. And majority of and that's also a problem. That's when you said that racism is a health crisis because racial wealth gap affects your health.
Right. All of these things were really coming to the surface through COVID. And I believe that it caused us to slow down just enough to pay attention to what was happening to people that didn't look like us. Mm-hmm. And as a former health commissioner, you are able to zoom out because you see all of the programs public health covers, like I said, prevention. So it's all of those things I mentioned, the lead poisoning prevention, obesity, infant mortality. And you start seeing these connections like, okay, if we address this, this is gonna help eliminate all of these other issues. So for racism, acknowledging that the city has a problem. And then what are we gonna do about it? So there's 5 steps. Essentially, public health always starts out with needs assessments. So you pretty much see what's out there, and then you get the information back, and then you figure out where to target your intervention. So needs assessment, using the Equal Rights Commission to be the catalyst for this needs assessment, creating a recommendation report. This report would be more specific to each city department, what's going on, identifying areas for change. Also looking at hiring practices. Oftentimes in government or any job for that matter, people say, oh, we're diverse, we have people of color, but you're like, okay, what about on your board, or what about
leadership
upper
roles,
management?
Right. Positions of influence.
Right, it should be throughout the whole organization, not just the direct service side. So a very intentional initiative to diversify management in city departments. And then also helping with policies. So what are our specific policies? Say you have Department of Public Works, you have Neighborhood Services, you have the police department. What are the city departments doing to not uphold racist policies and practices that we have had for many years that we may have even known were contributing to inequity? But what are we developing that's going to help make things better? And the key with that is the community is involved in that process from start to finish. It's not, oh, we come up with a plan because we have all our degrees and all this stuff, and we're gonna tell you what needs to be done. No, you tell us what needs to be done as a community, and then we will help frame it and create some opportunities to create interventions for change. And then the last item is helping other cities do the same thing. So like a kind of a peer system where you have other cities that are like looking at what you're doing and are like, well, we want to do this too. We see the value in this. We want to make a difference, but we don't know where to start. So helping others. Unfortunately, we were not able to include housing in our declaration. Housing is health. So if we talk about lead, if your environment in your house is contributing to your poor health, then that needs to be addressed, right? There's still issues with who can access lead-safe, healthy housing in this city. And rents are going up. It is very critical to address that basic human need.
So tell me, if someone cares about these issues, is it true that our elected officials can make these things happen, correct?
Yes, so at the local level, there's a lot of opportunity to bring about change. First of all, find out who your representative is and get their contact information and reach out. When they have the town halls, most of them have newsletters and things like that, like really being engaged, listening to what they have to say. You can go to the city website, get information.
Some of the conversations I have on these interviews is about the divisiveness in this country. Specifically in Milwaukee is this weird suburbs versus the city. You hear the suburbs like, why should I care? What would you tell them about why should they care when they go to polls? Why should they care about Milwaukee's public health issues?
Right, well, from a statistical perspective, you look at outliers, right? So whenever you have an outlier, that drags the rest of the data, the average. So if you have, whether it's on the low end or the high end, a group that is really, being more impacted than the rest or the average, it's going to shift the average. The curve is going to be, impacted by that. So I say that because some people, that makes sense to them, the whole statistical aspect of it. But I also want to appeal to people's hearts. Talk to people that don't think like what you think, or just hear them out so that you can start having a sense of understanding. You may not necessarily shift your views, but it's important to just have that civic nature of a conversation versus it being this like gang kind of situation that we're dealing with here. It's like, red, blue, when we're divided, we're weak, and I think there's some sense of blame, right? Like, well, it's coming from the White House, or it's coming from Black Lives Matter, it's coming from, it's like a lot of finger pointing, but we have to acknowledge that there's been problems in this country. There's been problems in this state and problems in this city related to race and ethnicity and opportunity. Like getting people to understand why people are in survival mode for decades because they've never had a fair shot. Yep. So let's fix it. Public health is very low cost, so it's a no-brainer to invest in it. This country has historically not put the money into public health that it needs to put into public health. But different states and cities operate differently. Some states and cities, they really invest in public health and others don't. Wisconsin and Milwaukee is one of them. So when a pandemic hits, we're scrambling. We don't have enough staff. We don't have the technology. You know, all of these things that really were revealed through our pandemic response because of the years of underfunding.
And that affects elections, right? Because that's a budget. So that when
Yes.
you're a voter, if you care about these issues, which public health everybody should care about, that's the thing you should ask these candidates. And then following up, what should a voter do if they still care? How does a voter keep their elected official accountable when it comes to these issues?
Well, civic engagement is a year-round thing. So it's not just for the elections, but it's in between elections. It's the midterm elections. It's all of these things. So staying involved with groups that are more of like advocacy or grassroots groups, whatever topic you're passionate about, say it's lead. There's many groups you can be tapped into that are going to make sure you're up to date with lead. They're sending messages, they're meeting with alders, they're meeting with representatives and senators. So that'll be my recommendation is whatever really pulls at your heartstrings, get connected with like-minded people for that issue and stay connected.
Thank you for taking the time to sit and us talking about voting, but more importantly, why is it important when it comes to public health?
Yes, and again, voting is not just for the election, it's all the time in between, staying connected, knowing what the positions are of people that are in the office and helping prepare people to move into these elected positions because we need more people that are going to represent the goodwill and the best interests of the communities that they serve.
Thank you.
Thank you.